Welcome everyone to today's webinar, Power System-Wide Patient Access with Intelligent Automation from Registration and Intake to Follow-Up. I'm Katie Adams with Becker's Hospital Review. We will begin today's webinar with a presentation and we'll have time at the end of the hour for a question and answer session. You can submit any questions you have throughout the webinar by typing them into the Q&A box you see on your screen. We look forward to hearing your questions. Today's session is being recorded and will be available after the event. You can use the same link used to log into today's webinar to access the recording. At this time, I am pleased to introduce our speakers. Bree Buck serves as the Access Solution Lead at Notable. Bree heads new solutions development for intelligent automation and patient access and digital engagement at Notable. At Epic Systems, Bree spearheaded Epic's Predictive Analytics Suite and led complex EHR installations for health systems, both in the US and internationally. Following her time at Epic, she developed digital transformation and digital front door strategy for more than 20 leading healthcare organizations as a consultant and strategic advisor. Bree holds a degree in public health and economics from the College of William and Mary and a master's degree in the London School of Economics. David Sugidpable serves as the Revenue Cycle Management Solutions Lead at Notable. He leads the solution development and growth of Notable's revenue cycle solutions. He serves as a subject matter expert and advisor to clients on how to partner with Notable to target areas of automation. Previously, David was a management consultant focusing on revenue cycle performance improvement, cash acceleration, and improving recurring revenue. He also served as an internal consultant to one of the largest private health systems in the US, focusing on revenue integrity to improve net patient reimbursement. David has a bachelor's degree in policy analysis from Indiana University, Bloomington. It is now my pleasure to turn the floor over to Bree Buck to begin today's presentation.
Good afternoon, and thank you for joining me here today. I'd like to welcome you to this discussion with Notable Health on how to power system-wide patient access with intelligent automation, from registration and intake to follow-up. Now that's a mouthful, but in all seriousness, we have a robust presentation planned for you today that will focus on the importance of a deliberate system-wide approach to patient access and how intelligent automation can power that approach. We'll talk more about what that means shortly. Before I begin, allow me to introduce myself and my colleague. And I'll have us go to the next slide. I am Bree Buck, and I lead solutions development for patient access and digital patient engagement at Notable Health. Through my role at Notable, I partner with healthcare organizations to design and deploy intelligent automation, which will transform access to care. And I'm thrilled to be joined by my colleague, David Sugidpable. At Notable Health, David leads the solution development and growth for our rev cycle automations. He acts as a subject matter expert and advisor to our clients on how to partner with Notable to get the most value out of automation. Thank you so much for joining me here today, David. Now, before I pass it over to David to kick us off, let me take a moment to quickly walk through today's agenda. First, we'll discuss the current landscape of patient access in hospital and health systems, with an eye towards the challenges that these systems are facing across the country. Next, we'll review a case study on access transformation from one of Notable's key partners. Then, we'll go into a demonstration of what system-wide patient access powered by intelligent automation can look like. And then we'll open up the session for a Q&A. The goal of today's webinar is to discuss the challenges that many organizations face in patient access and how intelligent automation can help solve these challenges. Now with that, I'll hand it over to David to begin our discussion on patient access challenges. David, over to you.
Awesome, thank you, Bree. I'll kick off today by describing the challenges that many revenue cycle and access leaders share with me each day. What you're seeing here is data on what revenue cycle organizations have experienced across 2021. Obviously, it's very influenced by the downstream effects of COVID-19, and these impacts include a changing payer mix of more Medicaid and self-pay patients and fewer commercially insured patients. This leads to changes in cash flow, more bad debt, and more uncompensated care. In addition, I frequently hear in conversations with revenue cycle leaders that collecting at the point of service is more challenging than ever, and this is due to frequent and high change of employment and insurance changes, along with increasing and higher copays and deductibles. On top of that, we see most revenue cycle teams have high vacancy and turnover rates, and simply put, there's not enough people to do this work. And many organizations are still grappling with the challenges of a remote workforce, trying to maintain high levels of productivity and morale in a very challenging time. Next, I'd like to discuss how the status quo for most organizations is not sustainable and how leaders are responding to this challenge. On this slide, you'll see three typical approaches in response to challenges we just talked about. First, you'll see that outsourcing the revenue cycle, while it's difficult to outsource the front end entirely, we do see more organizations considering end-to-end solutions. The pitfall here is evident as it relates to access, as organizations see control over their own operations and rely on a third party. The other reality is that many vendors that provide revenue cycle outsourcing still face an enormous amount of manual work and burden, and that ultimately impacts the patient financial experience and ability to collect from lack of synchronization. Second, in the middle visual, you'll see that leaders are buying point solutions. And I'll touch on this in a little bit more depth on the next slide, but point solutions do not only not talk to each other, but also create a complexity of extra downstream work for your staff. Finally, the third option we'll spend some time and detail on today is pursuing intelligent automation, which is the combination of RPA, AI, and patient engagement technology that can become the foundation of your front-end revenue cycle. And this can span from intake to scheduling to referrals and to authorizations. On the next slide, we'll spend some time discussing where front-end point solutions fall short. And you'll see here, while many different technologies that comprise the front-end revenue cycle, the data on this slide echoes much of what I hear across access leaders. This research comes from the Health Management Academy, and starting at the chart on the left, 60% of revenue cycle leaders are not satisfied with their current patient registration tool, and 62% are dissatisfied with their eligibility verification. Beyond the dissatisfaction with these particular tools, we find that front-end revenue cycle point solutions typically create a lot of back-end work or work queues for staff. They don't effectively catch errors, which leads to denials and rework on the back end. And in fact, about a quarter of all denials we see are caused by registration eligibility errors. They require an increasing amount of staff just to make all these pieces fit together. And they also produce a poor patient experience, which ultimately impacts our ability to collect. While outsourcing and point solutions are two very different approaches, ultimately, they are unsuccessful for the same underlying reason. And we'll talk about that in the graphic on the next slide. The reason that neither outsourcing nor point solutions can fix our revenue cycle is that they don't disentangle this massive web that you see in front of you. We know all too well that healthcare is a very complex lattice of largely manual interactions, such as paper forms, repetitive data entry, faxes, and work queues. Nowhere is this more evident than within revenue cycle. The status quo technology simply cannot address this fragmentation and complexity because of its limitations on how they can access health records and integrate into systems. At Notable, we design intelligent automation solutions around this fragmentation and complexity. It's our starting point for how we think about addressing your strategic challenges. For example, I'd like to take a moment to talk about how intelligent automation can solve this. If we move on to the next slide, whether you insource or outsource today, most healthcare staff workflows look like this. It's very complex, very fragmented, and hugely frustrating for the staff performing the work, as well as the patient on the other end. But if we work with Notable, on the next slide, manual workflows are replaced with digitized and automated flows, meaning digital assistants are performing manual and repetitive work on behalf of staff and clinicians. On the next slide, I want to talk about how does Notable do this. Notable's platform empowers providers to automate high-value healthcare workflows through a unique approach and combination of capabilities. Starting with on the top row, you'll see here, these are our solutions. These are parts of the healthcare system that have been disproportionately manual or where other digital point solutions have not been able to be fully automated, resulting in the organizational impacts we talked about earlier. Moving down to the second row, you'll see our approach. We start by codifying how workflows should work and developing your baselines. We then standardize those workflows for maximum efficiency and impact based on patient preferences and behaviors, as well as payer or policy changes. And finally, we move towards process automation and digitization by deploying and maintaining digital assistants to not only improve speed and quality, but also creating capacity for the admin teams. This is what turns manual workflows into flows. And finally, our capabilities are how we make this transformation happen. And we do that in 5 different ways. First is through intelligence, which determines when and how to perform a workflow on behalf of staff or clinicians. Second is through patient engagement, through texting, staff, web, app, email, and EHR, which all helps prompt the appropriate parties to take the next step. Third is seamless integration, which includes access to every field and every system via APIs and RPA, seamlessly links together disparate systems. The fourth is self-serve configuration, which allows for no-code optimization of automation to meet the unique needs of each organization. And finally, through root cause analytics, which drive continuous improvement in staff, patient, and physician adoption, as well as visibility into workflows that require optimization. Next, we'd like to make this a lot more real. My colleague Bree is going to walk through a case study of a notable customer who has transformed their registration process with intelligent automation. Then we'll walk through a patient journey and how intelligent automation streamlines every step of her interactions with the health system. And with that, Bree, I'll happily turn it over to you.
Great, thanks, David. And thank you for that great overview of all the challenges that are facing most organizations with patient access. So as David mentioned, I'd now like to walk us through this case study on patient access transformation with one of Notable's key partners. I'll have us go to the next slide. So I'd like to introduce you to Austin Regional Clinic, an independent physician-owned multi-specialty clinic that serves over 540,000 patients across 33 locations in the greater Austin, Texas area. And over the years, ARC has invested in providing a superior digital experience for their patient population. A couple things they've done include same-day and after-hours appointments, 24/7 ability for patients to schedule appointments, and access to care teams through MyChart, the organization's patient portal. But as operational and clinical leaders continued to improve access to care, they realized they needed to tackle not only those challenges, but also the challenges listed here. First, there was a key challenge to address the increasing administrative burdens facing providers and staff, which David just talked about. Next, there was a need to improve the experiences for patients who were tired of navigating the call center or needing to place a call to access care. Third, the organization needed to reach all patients and meet them where they were, not just those who were digitally engaged or had already signed up for the patient portal. And then finally, the organization needed to tackle denials that were stemming from registration and eligibility area. Again, about a quarter of all denials are eligibility and registration related nationwide. So to improve experiences and outcomes for all stakeholders, the patients, the providers, and the staff, the operational leaders at ARC recognized an opportunity. And that opportunity was to automate repetitive administrative and clinical tasks in their EHR by having digital assistants perform these tasks the same way that a human would. This was a clear way to drive key outcomes and target the root cause of those identified challenges. I'll have us go to the next slide to show some of the work we've done with ARC. And in working with Notable, ARC has automated a host of previously manual patient access workflows. You can see several of them here, including appointment reminders, patient registration, insurance card capture and plan selection, as well as eligibility verification, and then consent forms and things like point of service and pre-service collections. We'll see what several of these look like in our demonstration today. And the outcomes are noteworthy. By using intelligent automation, ARC received automated registration outreach, which drove 74% of digital conversion rates. And the downstream effects of this were minimizing outbound calls that could have been necessary to successfully get patients to complete the registration process. Now, since deploying Notable, 78% of these registrations are completely touchless, and this also minimizes work queue volume for front desk and call center staff. Now that we've looked at the kind of impact Notable can drive across patient access and the care continuum, let's take a deeper look at how this looks in a demonstration environment. David and I will now walk through an example of what this looks like with one of our partners and how the patient access at a system-wide level can look powered by intelligent automation. So we go to the next slide. I'm going to introduce you to one of our organizations and a blinded case study. This organization, we'll call them Pacific Coast Health System, is a 4-hospital health system of $1 billion in net patient revenue that operates in a highly competitive market in the West, where all of their peers have increased investment in digital experiences during the COVID-19 pandemic. And PCHS has received recent patient feedback that revealed frustration around several aspects of the patient experience. These include long hold times with the call center to book an appointment, having to fill out the same forms over and over again, both digitally and via paper, after seeing the same provider multiple times. And then on the flip side, a poor staff experience where overwhelmed access and registration staff were unable to invest meaningful time in patient interactions because they were drowning in downstream manual work. Pacific Coast patient experience was lagging behind peers and causing patients to choose competitor facilities, where it was far easier to schedule an appointment and get timely care. And in response, they invested in a number of technology solutions, many that we talked about earlier, including prior auth automation, eligibility verification, and a payments app. But none of these had increased patient engagement or made a meaningful contribution to the patient experience and staff experience. And as a result, staff frustration was at an all-time high due to the manual downstream work, which resulted in an immense staff churn of access and registration staff, as well as a hugely fragmented patient experience. So to show how Notable partnered with Pacific Coast Health System, and to show what an end-to-end transformed patient engagement experience looks like, we're going to break this down into 3 parts and look at each of those 3 parts as a separate part of the care continuum and patient journey. These will be initiating care, optimizing the visit, and then removing barriers to care. And lastly, I'll introduce our Pacific Coast patient. We'll be looking at the Pacific Coast journey through the eyes of Katherine Smith, a 47-year-old commercially insured patient of Pacific Coast who is overdue for a mammogram. This demonstration will chart her care journey from start to finish. With that, let's take a look at how she initiates care. Now, before we dive into it, I want to introduce you to this slide. You'll see it repeat throughout the demonstration and through the different parts of Katherine's journey along the care continuum. As Katherine is seeking care, undergoing the visit, and engaging a number of steps, we'll show you what a typical experience is, and then an experience powered by intelligent automation. On the top, you can see the challenges that a patient like Katherine was typically facing, which reflect what most of these patients are currently experiencing. These include inability to schedule a mammogram on time, as well as long hold times when calling in to book an appointment. And with respect to seeking care, before Notable, Katherine would have been on her own in needing to realize that she was overdue for a mammogram and perhaps would not have made an appointment until she was faced with an emergency. And on the bottom, just as important, are the challenges for health system staff. These include disproportionate call volumes to the call center staff that are there to answer these calls, and multiple point solutions required to resolve issues. At Notable, we've mentioned this a couple times, and I'll mention it again. We see that patient and staff experience as intertwined. And when we look at solving any of these challenges, we need to solve for both the patient experience and the staff experience. Now we'll go on to the next slide. While Katherine had been diligent about getting mammograms every 2 years since she turned 40, COVID-19 had made her reluctant to schedule one in the past year, and she was overdue for this key form of preventative care. What you see on the screen is Notable's digital assistant scanning the EHR, looking for a care gap, such as a missed mammogram. Notable has intelligence built in to read scan notes, mammograms, colonoscopies, and various lab results from several places where they're typically held in a health system, like a patient's chart, faxes, or PDF attachments. Since Katherine is a Pacific Coast patient who has been seen before, Notable is able to go into her chart, identify this care gap, verify that she has not closed it yet, and then begin the process of reaching out to Katherine to schedule her mammogram. So with that intelligence, Katherine then receives a text message that enables her to immediately schedule the mammogram. And we'll see an example on the screen of what that looks like. Katherine can click on the link she has texted, enter her name, date of birth, and phone number. And since she's been seen by a PCHS doctor in the past 3 years, Notable automatically matches her to her patient record in the EHR via FHIR APIs to provide a personalized experience. She is identified and asked to validate her insurance, but since the last time she saw a Pacific Coast provider, her insurance has changed. So Notable prompts her to upload a new insurance card with a photo of the front and back. Notable OCR reads the information off of Katherine's card, and Notable payer plan selection identifies her coverage record appropriately. This entire process will then trigger real-time eligibility to verify Katherine's insurance and enable Katherine to move to the next step in scheduling. She can then, as you just saw, add her appointment to the Apple Wallet in her calendar. And Notable also alerts her that she has a $30 copay for this screening procedure. This is all included in a scheduling, proactive scheduling outreach to the patient that then goes seamlessly into a registration experience to collect that high fidelity data up front. Through the process, Katherine was able to complete her pre-visit registration and schedule an appointment. And instead of Pacific Coast waiting for Katherine to realize she was overdue for a mammogram, reach out to the call center, obtain an appointment, and then come in and fill out all that paperwork, she was reminded proactively and then guided along that journey so that her mammogram could be as easy as possible and as frictionless as possible. I'll have us go to the next slide. And I bring up all those points because at the end of the day, what matters is the outcomes that this drives. We've talked a lot about how Notable is now powering this system access for seeking care or for initiating care. But the outcomes are the key to anything that's going on with the technology. These include a 97% patient satisfaction rate from patients using Notable, an 83% reduction in eligibility-related denials from improving the collection of registration and eligibility information prior to Katherine's appointment, and a 78% touchless registration rate with hundreds of thousands of calls eliminated per year and massively reduced work queue volume, which improves the staff and provider experience. This also translates into qualitative patient feedback, which shows that patients are thrilled with their experience. Got some examples of that on the screen. And all of this is driven by the unique approach of intelligent automation, which allows for patient self-service options to free up staff capacity, to collect high fidelity data, and use OCR-driven payer plan matching. Next, we'll take a look at how intelligent automation then enhances and optimizes Katherine's visit now that it's scheduled. Now I'll go to the next slide. And as I mentioned, this slide should look familiar, but we've now moved forward in Katherine's journey to optimizing the visit. Now that Katherine has touchlessly scheduled an appointment for her mammogram, she is on her way to having a best-in-class patient experience. but the diagnostic is just one step in a longer journey for Katherine. In her case, when Katherine went in for her mammogram, there was a suspicious finding. And so Katherine is then referred to a breast surgeon for a biopsy as a next step. Without Notable, the referral process might be time-consuming and even opaque to Katherine as the patient, requiring countless phone calls to check on the status and having to go through a scheduling process all over again, frequently entering the very same information that was already provided for the mammogram. Additionally, the referral process is often stressful and difficult to follow for health system staff as well, who are unclear of the process and the handoffs between different departments, and often have to go through several rounds of back and forth communications between different departments, providers, and staff in order to process a patient's referral. So let's look at how this process unfolds for Katherine with Notable. So before Notable, referrals would often happen via fax, even within the PCHS network. Someone in the call center would need to call Katherine to schedule the appointment with a breast surgeon, and if they had not reached her after 3 attempts, the referral would be closed without being scheduled. In this case, after the referral is made, Katherine simply receives a text message prompting her to schedule, and you can see what that looks like on the screen in front of you. In the same way that she scheduled her appointment for a mammogram at the outset of this care episode. Not only can shoring up the referral process be a huge source of time savings, as depicted on this slide, but hugely important to ensure Katherine continues to receive her care at Pacific Coast and doesn't seek care from a competitor. Katherine now has a consultation with a breast surgeon who recommends a breast biopsy. And following her visit, we'll see that she receives a text message prompting her to schedule this procedure. I'll have us go to the next slide. 10 days before Katherine's biopsy, she now receives a text message with important information to help her prepare for the upcoming visit. Now, instead of spending almost an hour on the phone with a nurse to walk through all of the pre-surgical forms, Katherine answers a number of questions from the comfort of her own home and her own phone to ensure the team at Pacific Coast is ready for her biopsy. While we find that most organizations have a standard list of questions, should policies change, the team at Notable can also easily update these questions at any time. Equally important to this pre-surgical checklist, she receives important pre-visit instructions that help her know what to expect for the procedure. The automation of these pre-surgical forms is not only part of an ideal patient experience for Katherine, but we also hear from our partners who use this form today that this is a massive source of time savings for the highly qualified clinical staff who typically walk patients through pre-surgical forms via phone. Now, the day before Katherine's biopsy, she receives a reminder to confirm the time of her procedure and to provide the location. She is also provided a QR code that she will use to check in for the procedure, as you can see on the screen. This helps Katherine to know where to go and to provide some wayfinding for her care journey. After Katherine has her biopsy, she then will receive, within 24 hours of her procedure, a questionnaire to ensure she does not have any signs of infection that could cause her to present to the ED. This is part of what we do with a lot of Notable partners, where we're able to log patient-reported outcomes and ensure that a patient is making a full recovery or having a smooth process after they come in for a procedure. And now back to the outcomes. So as we're optimizing for that patient visit, providing digital patient experiences, as well as self-service options for patient access, we're also looking to drive those outcomes for both the patient experience and for the staff. I'll call out a few key statistics that we see with Notable functionality. We see things like 64% reduction in no-show rate from pre-visit engagement with the patient beforehand. We also see things like 87% reduction in documentation for front desk staff, who typically have to collect a lot of this information prior to the visit, and 85% patient engagement, meaning every time Notable engages patients across use cases and demographics, 85% engage, which of course is then tied to a 97% patient satisfaction rate. We also see quite positive qualitative patient feedback from offering patient access and digital patient engagement powered by automation. One of my favorite quotes is here on the screen. The patient writes, "I have a baby and it's so much easier to let her crawl and play at home while I fill this out than trying to balance her and filling out forms in the office." And this is driven by all of the ways that Notable is different and unique in the approach, by a remembered and personalized experience, an outcomes-driven approach, and the elimination of manual work for clinic and office staff. We'll go to the next slide, and I'll now turn back to David to discuss how Notable assists in removing barriers to care, as well as some key takeaways from the discussion and demonstration. David, back on over to you.
All right, thank you, Bray. So to continue Katherine's journey, she's ready to move forward and schedule an MRI-guided breast biopsy. However, there are frequent barriers and challenges at this step from a patient and staff perspective. Staff are overwhelmed by high volumes of referrals, orders, and authorizations that frequently are reprioritized due to time sensitivity. And on top of that, staff are dealing with very time-consuming processes, searching and inputting for information between multiple tools to accurately obtain an approval. In turn, the patient is also frustrated by the inability to schedule a specialist referral or elective procedure. Patients are met with unclear answers from providers and left with little to no information on what's required to move forward. I'd like to take a moment to talk about how Notable solves for this through intelligent authorizations. With Notable, staff can focus on providing Katherine with the best care and patient experience, or focus on complex issues that require more time and attention. Our digital assistants ensure accuracy and timeliness to obtain authorizations for Katherine's MRI-guided breast biopsy. So how does Notable's intelligent automation tackle this? First, our digital assistants perform work queue cleanup and checks the payer portals to determine if an authorization is required. Second, for authorizations that may not be auto-approved, our digital assistants check authorizations pending approval and write the information back into the EHR for resolution and most likely next steps as well. And last, Notable provides a root cause dashboard for unsuccessful authorizations to providers, and this targets reoccurring issues. And we'll talk about this in the next slide. From a staff perspective, having a root cause analysis dashboard, such as our prior auth dashboard, provides insights to unsuccessful attempts, such as eligibility issues or missing and unclear documentation. This intelligent insight offers providers a way to identify and improve processes that would have otherwise delayed care for Katherine and future patients. From a patient perspective, with providers utilizing the Notable experience and platform, Katherine receives notifications to schedule her procedure, offering a very proactive and transparent digital process to improve the patient experience. With that, I'd like to talk about how Notable has proven success in intelligent automation, the kind of patient feedback we've received, and talk about what makes Notable different in this space. We've seen within our Notable platform that 90% of success, there's a 91% success rates in our prior authorization submission. We find that there's also 15 minutes of average time savings per authorizations for staff. And this really echoes back to having staff focus on more of the complex, higher and time-sensitive issues that patients may have. And then third, we also see a 20% reduction in write-offs related to authorizations. And back to what Bree mentioned earlier, a 97% patient satisfaction rate through engagement. Next, you'll see some of the positive patient feedback as well, such as it's very easy to walk through the steps to get scheduled. And very simply, it's an easy system to use to get through the registration process more efficiently. With Notable, I'd like to talk about how we approach intelligent automation and what differentiates us. The first, again, is automation of work queue cleanup and statusing. Second is patient scheduling initiation following an approval of an authorization. And third, providing those root cause analytics to increase authorization success. So moving on to the next slide, Bree and I talked through a lot today, and we'd like to just take a moment to recap some of the key points and next steps on how revenue cycle and access leaders can utilize intelligent automation for enterprise-wide patient access. First, typical approaches for revenue cycle improvement, including outsourcing and point solutions, will always fail short because they do not address the underlying manual work. Second, an enterprise-wide approach to patient access should include a broad range of capabilities on a common platform, including intake, scheduling, referrals, and authorizations. And last, intelligent automation should address the underlying administrative burden for staff, which enables them to focus on higher complexity and higher dollar accounts. With that, Bree and I would actually like to thank everyone who has joined today, and we want to open up this time to see if there were any questions that we can help address. Thank you.